Hello, everyone, and welcome to our monthly community podcast. My name is Anais Mares, Health Promotion Specialist here with Siouxland District Health Department. And today we have Sarah Blatchford joining us. She is a nurse here at the Health Department. Sarah, you have been on our podcast before.
Yeah.
But can you remind everyone what your role is here and how long you've been at the Health Department?
Yep. I have been at the Health Department as a public health nurse for 18 years. Primarily the last 5 years, I have been the vaccine coordinator for Siouxland District Health Department, and that's really my main full-time job.
Thank you, Sarah.
Yeah.
So it is back to school time, and it's the time of year where kids are supposed to be getting their immunizations in order to go back to school. Yep. Why is it important for parents to make sure that their kids' vaccinations are up to date?
Well, first of all, we know vaccines are very important and they prevent the spread of disease. So all children birth to 18 should be vaccinated. School leads us into requirements for vaccinations. So any child that is going to be in kindergarten or ages 4 to 6, a 7th grader, which those shots can start at age 11, and then your senior year or 16 to 18, all of those age gaps and grades, kids are required to have vaccines to be in the state of Iowa schools. So come school time, if your kid is going to be in kindergarten, 7th grade, or a senior year, please be checking with their provider or calling the health department to make sure they are up to date and they have what they need, because the rush is starting now to getting kids in for vaccines. So your provider might be very busy, and to get a school physical, I would start scheduling all of that right now.
So if a parent is unsure of what shots their child has or has to have in order to go back to school, is there a way that they can look that up?
They would have to talk to their child's provider and have them look up their shot record. We also can look in the Iowa database, and a lot of offices can also do that, and that can tell you if they're up to date for their age. They can give us a call, and we can pull them if they've been entered in the Iowa database, and we can tell them if they're up to date or not, so they know before school starts.
They would have to be a resident of Iowa.
Correct.
Okay. So we do vaccinations here, and like you said, those vaccination slots are starting to get filled up. Are there costs to these vaccines?
So for the VFC program, which stands for Vaccines for Children, anybody who has Medicaid, Iowa Total Care, AmeriGroup, Molina is now a new Medicaid program, has insurance that doesn't cover vaccines, has no insurance at all, or is American, Indian, or Native American, they qualify for our VFC program. We don't have doctors, but they can come for vaccines. If they do not have insurance, we will charge $15 flat. It doesn't matter how many shots they need, it's only $15.
Gotcha.
But they have to meet all those qualifications. Hawkeye is not one of them. Those children can see their doctor, and it will cover their vaccines. Right. It is an insurance, so Hawkeye is the only one we don't see. Any of those other qualifications, we can see them.
Okay. And then parents need to make an appointment in order for their children to get these vaccines?
Yep. When they call, we will make sure what they have for insurance or don't have. We will check the eligibility of the child, and we will schedule them for an appointment. We have clinics on Mondays and Thursdays. The last couple weeks of August, we have 3 clinics a week for 2 weeks in a row just to get school kids caught up, because it's going to be a rush.
And people can find this information on our website?
Yep.
Okay. Yep. All right. That's awesome. And, of course, when it comes to child vaccinations, it's only Iowa residents.
Correct. Each county or each state, like Dakota County has a health department that does Vaccine for Children program. We do the Vaccine for Children program across the street at Siouxland Community Health Center, and a couple providers in the area also do the VFC program. South Dakota has their own kind of set of rules and their own public health departments. So yes.
So ideally, they should check with their medical providers first.
Yep.
And then if that doesn't work out or if they have additional questions, they can always call us.
Yep.
Okay, awesome. So besides child vaccinations, what other vaccinations do we offer here at the health department?
So we do a handful of adult vaccines. The one thing I want everybody to remember, we do not bill any insurance. So if you're traveling and you want to get hepatitis, typhoid, all of those travel vaccines, we will not bill your insurance. You can try to submit it and see if they will pay for it. So if somebody has insurance and they want adult vaccine, I always say, number one, check with your doctor. See if they carry it. See if they can bill your insurance. Number two, check with a pharmacy, because pharmacies are carrying a lot more adult vaccine and they can also bill insurance.
Gotcha.
Step three, you can come to us, but you will pay out of pocket. And we have hepatitis A, hepatitis B, MMR, chickenpox, typhoid. We do not carry yellow fever. That is a big question we get. We send people to Sioux Falls or Omaha for the yellow fever vaccine. And we do a lot of TB skin tests. That is $30. We do those every day but Thursday. And a lot of kids going back to any medical school, CNA school, they're coming for those TB skin tests.
So TB skin tests are $30. Mm-hmm. Do you know what the cost is for the other immunizations off the top of your head?
Off the top of my head, like a Tdap, which is a tetanus with pertussis, that is around $80. Your MMR and varicella or chickenpox are $100 to $120. They're a little bit more expensive. Hepatitis are about $90, $95. And a lot of those have a series, so it's not just one and done usually. So there is out-of-pocket cost for our adult vaccine because we just can't bill insurance.
Right.
Yeah.
Yeah.
Yep.
So ideally, again, check with your medical provider, and then, if you don't have insurance or a medical provider, you can come here, but just know that there are those costs to those vaccines.
Yep.
Okay, and people would need an appointment for those vaccines as well, right?
And travel vaccines, actually, you can make an appointment on our website, SiouxlandDistrictHealth.org, and it'll even link you to the CDC website under travel, telling you exactly what you would need to go to the country. And that's what we look at to tell you what is suggested that you get.
Right.
We just go to the CDC, and that link is on our website, and then you can schedule your own appointment on our website for travel. Not for children, but for travel.
But for travel.
Yep.
That's about
and
it.
TB skin tests.
And TB skin tests. Otherwise, they would have to call or make an appointment here. Okay. Who should the public contact if they have any additional questions? Should they contact you? Just our general health department line? Yeah,
they can call the health department line and just ask for the nurses. I usually am in the clinic, so I usually do get the call, and I can answer the questions they have and what is the school requiring. I know the schools have sent out letters for kids going into those grades that they are going to need those vaccines, so parents should know a little bit that that's coming. Summer goes fast, so it's coming now.
Yeah.
So try to get in, because clinics will fill up and school will start, and kids, it'll be hard to get them in.
Yeah. So, it's coming up very fast.
Yes.
Okay. Anything else you would like to add?
No, I just think remind kids that vaccines are to keep them healthy, that it's not a punishment they're getting a shot.
Yeah.
Kids are super smart, so just educate them. We need to have it for school. We need to have it to keep you healthy. It's going to be quick. Take some deep breaths, and then it's done. And that's it.
It's very important.
Quick. Yes, it's very important for the health of them. So, yes.
Definitely. Yep. All right. Well, thank you, Sarah, for joining today. If you have any additional questions, feel free to give us a call, 712-279-6119.